get ready to take control of your healthcare. Here's your host, Ray Cober.
First introduction to how many players there are and how many middlemen in this, whole field. And
do tell, Marilyn.
yeah, I know.
There are middlemen?
Yeah, I know. I was absolutely surprised. All the middlemen, and I consider TPAs and insurance carriers middlemen. The executive branch was upset. The employees were upset.
Well, so I guess everything is relative. So those sound like big numbers, and it sounds like people were upset, so they were meaningful numbers. But just to put it into perspective, like as far as the overall budget, what percentage of the budget are we talking about?
Well, that's a really good point, and I can't remember, to be honest with you, on that.
No worries.
But it was a $200 million plan. Extra wellness programs, those types of things.
How dare you, Marilyn?
I know.
I am sure that some of the higher ups lost good golf buddies.
They did lose golf buddies, they lost good friends. And because you have a legislature, then if 80%, you were losing 40% on. So I was able to bring those facts. I mean, I'm getting really nerdy here, so I apologize to our audience.
No, I love we love this stuff. Some of us geek out on the numbers. I'm one of them. And look, the beauty of a podcast is if the audience gets bored, they could simply go and listen to something else. But you keep going because I love what you're saying. So
to reprice.
Sounds like you have trust issues, Marilyn.
Oh, I really do. That comes from being an accountant. We don't trust anybody. This is a term we developed called procedure-based maximum expense. Good, huh? And
like how dare you add another acronym to the insurance? Oh my God, my head's going to explode. Okay, PDMA.
And it meant that we would pay that facility. The legislature was able to get $52 million back by doing an employer premium.
Stop the press. Hold on. Time out. The actuary said you were going to lose $9 million.
Mm-hmm.
You ended up with a $52 million surplus.
Well, actually, what we ended up in, he said in 2017 we'd be at minus 9 million. We had 112 million to the good.
Holy crap!
And that was because of a lot of things. It was mainly the reference-based pricing, but we changed to transparent pass-through pharmacy. It was a heavy fire season in 2017.
Marilyn, did you get a raise?
No, I didn't. But I got to retire.
Oh my God! My next calling. I'm going to be. You know how there are sports agents. I'm going to be agents for business professionals. That is unacceptable. You saved 112 million. They didn't give you $1.
Didn't get a raise.
Oh my God!
No, I think no, we didn't. But we then would lend the general fund money. But being an accountant, I made sure we got the statutory interest rate on those funds. And getting it back to the employees and the taxpayers.
Right. Yeah. And who could have a problem with that other than the golf buddies?
Oh, I'm so glad you brought that up. Yeah, you're absolutely right. The golf buddies.
Well, listen, I hate to shine a light on it, right? But with that kind of money at stake, you could imagine, those courtside tickets to the games, that money comes from somewhere. They're fighting tooth and nail to keep that behind closed doors, to keep your information, which is rightfully yours, ladies and gentlemen. They're keeping that away. Now, why would you think they don't want you to see that information, right? It's crazy, but you absolutely have a right to it. And
to be able to do a little bit more comparison. And one of the things that's interesting, two of us have focused heavily on the federal employee health benefit plan, which is the same as any employer health plan, except it happens to be fully insured.
Oh, God. So when I hear fully insured, I think to myself, full retail plus. It's just, it is no way to manage any budget. You just, you're the foxes guarding the hen house, baby.
Oh, it absolutely is. And to think that, and I can understand how that came about because it was in the 60s and 70s before self-funded really got it out
Sure.
there. And by the time all that's put in law, it's just a big machine that moves forward. But to be taxpayers to be paying for a fully insured plan and to help a specific funding line for contingency fund
Yep.
is beyond my comprehension. So I've been having fun following the money and reading audit reports there. So that's my life now.
That's crazy. Listen, I was literally on the phone this morning, today, before we got on, with a controller for an HVAC supply company. And they, not a big plan. They have 50 odd people on plan. They're spending like 1.2 million a year. So their average is over $20,000 per employee per year. And they're spending like 1,500 per month for a single, 3,000 for a family.
We had one major union. Over 60% of the employees were in the public employee union.
Hmm.
And I think what happened is that the Sheila Hogan, director of administration, and Dan Villa, budget director, and the governor Bullock had really good relationships with the union leadership.
Yep.
And so bringing the union leadership in right up front, I couldn't have done that. I wouldn't have known how, but
Yep.
I have never worked in that realm. But bringing the director in right up front and being part of the team, and he was with us. Eric Feber was his name, and he was with us every step of the way and knew
Mm.
what we were doing. And then he could disseminate the information out because we had the same goal. The same exact goal was to get pay raises and good benefits for the union. And so that was the strategy. I didn't come
Genius.
up with it, but it was ingenious that
It really is. It's so important because ultimately you have the same goal,
yeah.
right? A union leader wants the best quality healthcare for his members, her members, and at the lowest cost. Because let's face it, if the employer or the organization uh, that is employing the union members is saving money here, it leaves it leaves money that can flow into the pockets of those union members, in addition to many ways that those funds can be appropriated. But one of the things that I always advocate for as a consultant when I am dealing with an employer or an organization is at least have a plan to take a portion of the savings and give it back to your people.
But I like your strategy there. That was really, really excellent. And our leadership did that for us.
Wonderful. Yeah, it's so important because at the end of the day, it shouldn't be a contentious relationship.
No,
Whether it's union and management or employee employer, employees are the lifeblood of any organization. You got to treat them well, and you got to take care of them. And if they're feeling unappreciated and it's all about, the people in the ivory tower, things aren't going to end well.
no, they really aren't. And you're
Yeah.
talking about their health
Yes.
and their family's health. Yeah.
Exactly. Anything else you wanted to touch on or talk about today?
No, I think I congratulate you on what you're doing. You're hanging in there. You're doing great work, and it's hard. And I thank you so much for this opportunity. Thank you.
No, my pleasure, Marilyn. I would tell people where to find you, but you're retired, so you don't want
Yeah.
anybody talking to you.
No, I'm in Montana in my little cabin here.
There's something very appealing about that. I've been a native New Yorker my whole life, and I love New York. I live in New York City, Long Island. I wouldn't trade it for anything, but Montana sounds like it has its appeal. Might be a little
It
cold
does.
right now, though. It's
Yeah,
11
it
degrees
is real
here in New
cold.
York City, so yeah, it's pretty chilly out there. All right, folks. Well, hey, thank you for joining us on another episode of Broken Healthcare. Until next time, peace and love always. Take care, folks.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.